Hello, and welcome to today's webinar, hosted by Capital Insurance Agency, Inc. We have serviced state of Florida agencies and universities for 50 years, providing various insurance benefits and financial services for over 100,000 insureds. Our offices are located throughout Florida as we are dedicated to providing our clients with a complete portfolio of superior employee benefits. Today we will be sharing information with you on Cigna's prepaid dental plan. Having dental coverage gives you plenty of reasons to smile. Quality, regular dental care not only helps you look better, but it also helps you feel better about yourself, and it can even make you a healthier person overall. The key is to take care of your teeth and gums before problems begin, and we help make it simple with our dental plan. The Cigna Dental Care Plan allows you to maximize your savings. First, you will typically pay less for the Cigna Dental Care Plan than for other dental plan options. Second, there are no deductibles. Deductibles are amounts that individuals sometimes have to pay before their plans begin paying for a portion of their dental care costs. With the DHMO, there is no upfront expense before your coverage begins. Third, there are no annual dollar maximums. Annual dollar maximums are dollar limits to what a plan will pay for your dental care in a specified period of time, such as a plan year or for your lifetime. The Cigna Dental Care Plan doesn't have any annual dollar maximums. Any frequency limitations under your plan are outlined in your Patient Charge Schedule, PCS. And fourth, there are no percentage copays based on a covered procedure. Your out-of-pocket costs for covered procedures are listed on your PCS, regardless of which Cigna Dental Care Network dentist you visit, making it easier for you to budget for your dental expenses. Everything you see here is included with your Cigna Dental Care Plan. Preventative care such as cleanings and exams, sealants, restorative care such as fillings, and specialty care such as orthodontia. View your PCS for any limitations and exclusions. Each member of your family can choose their own network dentist. This is important when, for example, your child is away at school or your spouse needs to find a dentist near work. Second opinions are covered. Just call customer service and they will help you make the arrangements. If you are in pain and need immediate care, call customer service for the name of a nearby network dentist. If an emergency occurs after business hours or a network dentist isn't available or you are out of the area, you can use any dentist. Cigna Dental will reimburse up to $50 of your costs, less applicable patient charges. General anesthesia, IV sedation, is covered when medically necessary and performed by a participating oral surgeon or periodontist. Your Cigna Dental Plan includes thousands of in-network dentists. You can find a dentist either online at Cigna.com, mycigna.com, or by calling Cigna Customer Service. Cigna offers oral health programs and services. The Cigna Dental Oral Health Integration Program outlines the dental services available with qualifying conditions. The program provides articles on behavioral issues linked to oral health and discounts on prescribed mouthwashes, fluoride gels, and toothpastes from your dentist. Through Cigna Healthy Rewards, Cigna Dental members have access to discounts on a full range of health and wellness programs and services often not covered by traditional insurance plans. In addition, the Cigna Dental Plan gives you access 24 hours a day, 7 days a week to trained professionals that can answer your questions regarding your dental treatment and symptoms. Tooth decay is one of the most common chronic infectious diseases among U.S. children. The fact is, cavities touch all age groups. Older adults are more likely to have decay around older fillings and decay of the tooth root itself. Periodontal gum disease is an infection of the tissue surrounding and supporting the teeth, and it is a major cause of tooth loss in adults. Moreover, mounting research has linked gum disease to more serious health issues like heart disease, stroke, diabetes, and preterm birth. Gum disease is usually painless, therefore you may not know you have it, and that's where Cigna Dental comes in. The cavity and periodontal risk assessment tools help individuals determine their risks for cavities and gum disease respectively. The tools are available online to members and the general public alike and function in a similar way. Individuals complete a brief quiz, and the tools provide a score indicating their risk for cavities or gum disease, depending on which tool the person has completed. Risk levels are as follows: low, low to moderate, moderate, or high risk. Members can then print the detailed score sheet and take it to their next dental visit. Armed with these results, patients and dentists can better manage their overall oral health. Cigna is here to service your needs 24 hours a day, 7 days a week. You can call customer service anytime, day or night for assistance with your dental plan, or you can use our award-winning website, mycigna.com. Both the customer service line and mycigna.com can help you find a network dentist, answer questions regarding your Cigna dental coverage, and help you find out the status of your Cigna dental claims. The Cigna dental plan is an affordable option for you and your family. Employee only, $22.81 per month. Employee and spouse, $44.94 per month. Employee and child or children, $53.59 per month. Employee and family, $68.46 per month. If you're bi-weekly, just divide the monthly premium by 2. All you need to do to enroll is log on to People First and use plan code 4034. The following limitations apply to most Cigna dental care plans: 2 cleanings and bite wing x-rays per calendar year, 1 full mouth Panorex x-ray every 3 calendar years. TMJ treatment, when included on your patient charge schedule, PCS, is limited to 1 occlusal orthotic device every 2 years. The replacement of crowns and inlays and prosthesis over implants, if unserviceable and cannot be repaired, is limited to once every 5 years. The frequency limitations of certain other covered services are set forth in the PCS. In general, only those services that are medically necessary and listed on the PCS are covered. The following services are generally not covered unless otherwise listed on the PCS or required by law: experimental and cosmetic dentistry, and any services that do not meet common dental standards; treatments or surgery if associated with a poor or hopeless diagnosis; the recommendation of any inlay, onlay, crown, post, and core or fixed bridge, or implant-supported prosthesis, including crowns, bridges, and dentures, within 180 days of initial placement. Crowns, bridges, and implant-supported prosthesis used solely for splinting. Completion of crowns, bridges, dentures, or root canal treatment already in progress on the effective date of your Cigna dental coverage, and, if your plan includes orthodontic coverage, the following is generally not covered: incremental costs associated with optional elective materials, procedures or appliances to guide minor tooth movement or correct harmful habits, replacement of appliances that have been lost, stolen, or damaged due to patient abuse, misuse, or neglect, or any services which are not typically included in orthodontic treatment. This is not a complete list, and the terms of your specific dental plan may vary. See your plan documents for a complete list of plan terms, conditions, limitations, and exclusions. California and Texas residents, treatment for conditions already in progress on the effective date of your coverage are not excluded if otherwise covered on the PCS. We would like to spend the next few minutes answering some commonly asked questions. Here is a list of the most commonly asked questions during the enrollment period. 1. Are there deductibles or calendar year maximums? No, there are no deductibles, no calendar year maximums, and no percentage copays based on a covered procedure. 2. How many cleanings are allowed under the plans? 2 per person, per year, and must be 6 months apart. 3. Does this plan cover orthodontists? Yes. 4. Can an employee change their dentist? If so, when and how? Yes, as often as needed by calling the service center. 5. Can an employee take dental coverage with them when they terminate or retire? If so, how? Yes, for 18 months through COBRA. We hope this helps to answer some questions you may have regarding this plan. Capital Insurance Agency is proud to partner with Cigna to offer you the prepaid dental plan. Please visit the Capital Insurance Agency website at www.capitalins.com and view the policy brochure. Then, make the election into your People First system for the coverage that fits your needs. Please feel free to call our home office located in Tallahassee, toll-free at 800-780-3100. We know how valuable your time is, and we appreciate you spending it with us today as we provided an overview of the Cigna prepaid dental plan. We hope that you have found it to be informative, and we look forward to serving you.